This is very interesting. Another fantastic presentation. And you know, I think this is what I love about our field. You know, as I said, we're very serious. These are phenomenal, 4 phenomenal finalists, and we're going to round this off with Dr. Audrey Wells from WhisperSom, who's going to come talk about PST-1 for sleep apnea. Please welcome her.
Home stretch, everybody. All right, I'm Dr. Audrey Wells. I am a sleep medicine and obesity medicine physician. I'm also certified in menopause and consider myself an advocate for women's health. Today I'm talking about a device that we call the PST-1 for sleep apnea. It's one device that can test, treat, and track. So you've heard about the problem with obstructive sleep apnea. There's a massive untested disease burden out there. And I'd like to encourage you all to think about what's happening under the cloak of darkness with people who are undiagnosed and untreated. They're experiencing inflammation and stress, not just physiologic stress, but psychological stress, as a result of an untreated breathing disorder. And home sleep apnea testing represented a great way to bring more people to diagnosis and care, but it still has significant limitations, particularly the type 3 devices that are inaccurate, may yield a false negative result, and only typically measure 1 night of sleep. We all know the AHI is limited. There's no difference in scoring a 10-second apnea versus a 40-second apnea. We're only just understanding what hypoxic burden can do for diagnosis and severity labels. We still don't know what to do with mild sleep apnea, and this includes sleep apnea that is primarily REM-related, so you dilute your AHI with all the non-REM sleep, and this disproportionately affects women. There's not a great appetite out there for what's on the treatment menu currently. And I've sat across from literally thousands of patients in small rooms trying to convince them to try something. And as John alluded to earlier, this is a barrier to getting tested in the first place because people don't like what's on the treatment menu. Alternatives to CPAP tend to be unpredictable, and sometimes you go through a lot of time and expense before you find out that it works. And most sleep apnea treatments are actually active the entire night, which is a difference related to the PST-1 that I want to highlight. Finally, this is really expensive health-wise. People's cognitive health, cardiovascular health, metabolic health, and mental health are affected. We are talking about huge systematic inefficiencies and significant economic burdens for not only employers, but health plans as well. Our solution to the problem is called WhisperSom PST-1, and there's 2 components to this device. One is the body watch, which fits around the midsection and uses excursion of the chest to estimate breath. It tracks inhalation and exhalation and identifies different points within those waveforms so it can target when the respiratory pacemaker is firing. In the figure on the top right there, you'll see the inhalation going up and represented with green bars at the bottom. Exhalation goes down in the blue bars. And in the middle, there is an apneic event. The apneic event is getting scored right as the bar is turning yellow, and there's a very faint pink salmon-colored bar here, just above the yellow, which represents the signal coming from the body watch to the earbuds. The earbuds are the second piece of equipment. When the body watch detects that apnea, it sends a short, quiet signal to the earbuds to stimulate that respiratory pacemaker to fire. So it amplifies or replaces the signal, and in that way, it prompts breathing, and you can see the respirations resume. The body watch also measures oximetry, heart rate, detects movement and snoring. And the bottom figure there is from the patent showing how the device looks when it's worn. I went through a little bit of the mechanism here, but again, the monitoring is for phase synchronization to the respiratory pacemaker. And in the field trials, we were not trying to eliminate or prevent apneas, we were trying to intercept them early. So that early detection of missed breath is what fires a precisely timed signal at low decibels, and this is what it sounds like. There's about 20 different signals to avoid habituation, and because they are applied during that reflex-sensitive window of the respiratory pacemaker, you get sequential activation of first the hypoglossal nerve and other pharyngeal dilators, followed by the phrenic nerve that depresses the diaphragm. And the result is a physiologic negative pressure breath. The body watch also has the capability to evaluate its performance. So if it gets the resumed breath, then it knows it did a good job. If it doesn't get that, it can apply another signal and even modify its performance over time. So this is a closed loop system. It's adaptive. It only intervenes for missed breaths. It does seem to bypass ascending arousal pathways that would cause the patient to wake up. And this is the most common question we get. So it does not seem to interfere with sleep. Importantly, it treats all forms of sleep apnea, obstructive, central, and mixed. And I want to show you some of the testing from the field trials, which are made up of about 125 nights, 21 volunteers that were not difficult to find. I'm going to show you data from about 2,500 apneas. Half were untreated or sham, half were treated. So this device caused a 93% reduction in medium length apneas in around the 20-second range, a 99% reduction in time in apnea where individual events were above 20. There were improvements in oxygenation, 97% reduction in time less than 90%. So the blue bar is showing 121 seconds per hour, less than 90% in an untreated sample, going down to 4 seconds, less than 90%. 79% reduction in ODI-3, quite significant there too. We looked at motion as a surrogate marker for arousal. There was a 28% reduction in motion, so people were sleeping more soundly, and a 57% reduction in heart rate spikes above 40 beats per minute over baseline. That was the first innovative component of this device, is just the technology, which is using anatomy and physiology to get a neuromodulation response. This is the second way this treatment is innovative. It completes a test, treat, track cycle. So I've described the device in treatment mode. I want to just direct your attention to the top of this slide and point out that if you turn the treatment off, this is a home sleep apnea test capable of multi-night monitoring. It produces a PSG-like montage with real-time auto-scoring, so you have the transparency component there. It is also capable of tracking or doing remote patient monitoring when recording and treatment are turned on. This allows for optimization of breathing during sleep, no matter how severe the condition is. So it's full cycle treatment. Lots of benefits. For patients, it's comfortable, it's portable, it can work alone or with other treatments because it's a completely new mechanism. It corrects breathing during sleep, and the most common feedback we got in the field trial was, "Can I keep it?" For clinicians, I think it would be fantastic to see better adherence to therapy, improved outcomes, and patient satisfaction translates to provider satisfaction, which is awesome. This device, because it is ready to get started with treatment right after diagnosis, It also opens up the possibility of a therapeutic trial, even the night following diagnosis, and I think that's really cool. For systems, you're looking at reduced costs, high ROI. This is a scalable product. It is efficient, home-based, and provides fast and sustainable results. So far, the company has raised about $6.5 million in seed funding. The device is in version 8. The data that I showed you is from version 6. Currently, we're offering Series A and anticipating clinical trials starting next year. We have a FDA submission in, and we've got to answer a couple of their questions. And at the bottom here, I've just sort of shown you a timeline of how the company has looked over the past decade or so. The hard part's done. The proof of concept is nailed down. The device works better than expected, and we've demonstrated technical and clinical success. In summary, this device has 2 modes of innovation. This is a novel tech solution for sleep apnea. It's adaptive neuromodulation. It's a physiologic breath only when needed. It does not seem to disrupt sleep quality. It is safe, effective, and comfortable, and I anticipate a great deal of appetite for this device. It also completes patient care with a test, treat, track trifecta. It's capable of diagnostics, multi-night testing, treatment of all forms of sleep apnea, and long-term monitoring so that people can achieve sleep optimization by eliminating their breathing disorder. This is a unified and scalable approach to sleep apnea. Thank you.
Congratulations, a fantastic, really amazing presentation. And all 4 presenters have done an amazing job.